Hello, welcome to today's session. I'm Christine Jikondiro. Today we are going to continue with tropical and communicable disease, where we are going to start the unit of bacteria infection. Now we are going to talk about tuberculosis. At the end of this session, you will be able to define tuberculosis, to identify different type of tuberculosis and its transmission, to discuss the prevention and treatment of tuberculosis. Tuberculosis is an infectious disease and transmissible due to Mycobacterium. There are two types of tuberculosis, two types of causative agent which can cause tuberculosis. The first one is Mycobacteria tuberculosis, which is also called Koch bacillus. The second one is Mycobacterium bovis. Transmission of tuberculosis is primary by air, where it can be transmitted directly through droplet spiral and indirectly through droplet nucleus, which is found into the air. The reservoir of tuberculosis are human and animals. In human, we found healthy infected human, and we found also the person with pulmonary tuberculosis with a positive microscopy. In the animals, we found dolphins, monkeys, cats, dogs, etc. The pathogenesis of tuberculosis. After annihilation of bacillus, the development of tuberculosis in a previously uninfected child or adult person can be found in three types. The first one is primary tuberculosis. The second is post-primary tuberculosis. The third one is miliary tuberculosis. Primary tuberculosis. A susceptible person becomes infected by inhaling Mycobacterium through droplets of sputum, which can be liberated by coughing or speaking from an infectious tuberculosis person after repeated exposure. The risk factor of getting infected by primary tuberculosis is bad ventilation and overcrowding. Post-primary tuberculosis, also called reactivation, this will occur as a result of reactivation of formerly dormant mycobacteria in the tuberculous, which was formed during the primary tuberculosis period. And this can occur in 20 years or more later after primary tuberculosis healed. Miliary or disseminated tuberculosis. It occurs when the red blood vessel is eroded by TB, whereby the bacilli get disseminated in the blood and affect the other organ of the body. It results as fulminating, means it is often sudden onset and it has a rapid progress, and also it is an acute infection. It normally occurs in very young children, very old people, and those who are immunocompromised. Clinical manifestation of tuberculosis. The client with TB will have productive cough, which can last 2 or more weeks. They have also emptysis, means they are going to cough out the blood. They have also dyspnea, which is difficult in breathing. They have thoracic pain. They have fever. They have also night sweating. They have anorexia. They have asthenia. They have weight loss. The client also may present other signs and symptoms according to the affected organ when she or he has extrapulmonary tuberculosis. For diagnosis, we use bacilloscopy where we do sputum examination. At this type of diagnosis, normally 2 sputum have to be collected in 2 days and be examined by using microscopy. You can use also tuberculosis skin test to test if the client has tuberculosis. We can use radiography or chest X-ray. You can use also gene expert in diagnosis of tuberculosis. Prevention in the control of tuberculosis. First of all, you have to treat the sick people in order to cure illness and prevent the spread of the disease to others. We must also respect the strategy of World Health Organization in TB treatment, which is known as DOTS. When you talk about DOTS, it's a directory of self-treatment short course. Means the client who has TB have to take treatment under supervision of a healthcare provider. We have also to use combination therapy in treatment of anti-TB in order to prevent the resistance to one anti-TB drug. You have to treat the TB using two phases, and the first phase is called intensive therapy phase, which is there for 2 months, and the second one is continuation therapy phase, which there for months. We have also to use chemoprophylaxis, where the molecular which is used is isoniazid. Isoniazid can be used for 6 up to 9 months to prevent the development of subclinical infection to active infection. Means it is mostly used to the client who has been infected, who has been showing the sign of infection, but who didn't show any sign and symptom of active TB. And it is usually done in children and other people who have recently become tuberculosis positive and in people with HIV positive who has been exposed to the person with TB disease. Isoniazid has shown inactive or ineffective impact in reducing the risk of active tuberculosis, where the people who is infected with TB and use take isoniazid as chemoprophylaxis would be protected of getting active TB at 90%. Immunoprophylaxis also with BCG is very important in prevention of tuberculosis. Case finding and the treatment also. When you get a person who has active TB, it is very important to do screening of family members to find out if there isn't any person who has TB. Then it is also important to treat those people with active tuberculosis, and also we have to educate the population. You have to educate the people about to avoid to spread anywhere, to avoid overcrowding area, and to avoid poor ventilation. For the person also who has active TB, they have to be isolated from other person in order to reduce the risk of spread tuberculosis to other people. Case definition of TB. In tuberculosis, you have pulmonary tuberculosis sputum smell positive, means the client has shown one or more positive sputum smell examination. There is also pulmonary tuberculosis sputum not done, means the client is treated based on the clinical or radiological examination, means the sputum examination was not done. This is normally done specifically in children who are not able to cough out and get the sputum. There is also extrapulmonary tuberculosis. This is tuberculosis which affecting other organs rather than the lungs. For the patient who present both extrapulmonary tuberculosis and the pulmonary tuberculosis, they have to be classified as pulmonary tuberculosis because, as you know, the person who has pulmonary tuberculosis are the one who spread the disease to other people. So why, if a person has both extra and the pulmonary, please classify her or him as pulmonary tuberculosis, which is very dangerous. There's also new case. Those are the people who had never had treatment for TB or who has taken anti-tuberculosis drug for less than 4 weeks. There is also the relapse. Those are the person who are infected after being treatment completed or after being declared as healed. There is also treatment after failure. Those are the treatment who start treatment after previous treatment which has failed. There is also treatment after default. Those are the people with positive sputum smell which flow the interruption of treatment for 2 consecutive months or more. There is also transfer in. Those are the people who start anti-drug, anti-TB treatment at health facility, then they have been transferred to the nearest health facility to continue the treatment. On that case, the second health facility we classify the client as transfer in. Treatment of tuberculosis in Uganda. We have first line treatment which will do 6 months, 2 months. They have to combine rifampicin, isoniazid, pyrazinamide, and ethambutol. Then in 4 months, they have to take a combination of rifampicin and the isoniazid. This regime is indicated for new case of TB for those who are previously treated but who has resistance in rifampicin, which was susceptible on gene expert test. Treatment for children means the newborn up to 14 years old. They have to take a combination of rifampicin, isoniazid, pyrazinamide for 2 weeks, the 2 months, with ethambutol also for 2 months. Then they have to take the combination of rifampicin, isoniazid for 4 months. The rifampicin must have 75 milligrams, isoniazid 50 milligrams, pyrazinamide 150 milligrams, and ethambutol 100 milligrams. In treatment of acute TB, please you have to administrate the drugs based on the weight of the client. Special category, we have new and previously treated case with meningia and osteoarticular TB. For those persons, the duration of the treatment is 12 months. Means the intensive phase is 2 months as usual, but the continuation phase is 10 months for adult person and even for the child. And remember to administrate the drug based on the weight of the client. Treatment in case of multi-resistant TB, the client have to take regime of 9 months, where they have intensive phase of 4 months, continuation phase of 5 months. In the 4 months, they have to take different molecular which are in combination of one template, and also they have to take canamcin as injection. Then for the continuation phase, they have also to take a combination of 4 molecules. Those molecular are shown in this slide. When we say PM, it is canamcin, and canamcin is injectable drug. There is also moxifloxacin, there is also protonamide, there is also chlorphloxamine, there is also pyrazinamide, ethambutol, and isoniazid. As you see, we have 3 molecules of the first line which is also used in multi-resistant TB. Extrapulmonary TB. Normally, extrapulmonary TB is any case of tuberculosis apart from pulmonary paration. We found pleura, precardium, peritoneum, ganglion, bone, articulation, meningia, internal organ, skin, etc. And the most frequent form are ganglionic TB and pleural TB, then disseminated TB. The most frequent are pericardia and meningeal tuberculosis. Ganglionic tuberculosis, the most frequent cause of it is the most frequent cause of adenopathy in the country with high prevalence of tuberculosis. And the neck ganglionic are the most attached. It is attached at 65%. The cervical ganglion are the most attached. The adenopathy are unilateral or bilateral. They are asymmetric, they are painless, and initially they are elastic, then they come hard, cold, and also they are chronic in most of the cases. The person who has ganglionic tuberculosis, they have loss of weight, they have night sweats, and they have also fever. The essential examination which must be done in a ganglionic tuberculosis are bacilloscopy if the client has cough, bacteriology, histological biopsies, means the exam and the culture, then the treatment, you have to give the anti-TB drug without waiting the result of culture. Pleural effusion or pleural tuberculosis. This is the TB which attack pleural membrane. The clinical sign for the client who has pleural tuberculosis, they have dry cough. When you talk about dry cough, this is the cough which didn't produce a sputum. They have also thoracic pain, which is very, very severe. And they have also weight loss, weight sweat, fever. Then the radiological sign and ultrasonography for confirmation must be done. They have also to do bacilloscopy if the client has able to produce a sputum. Pleural puncture and the pleural biopsy also must be done. For treatment, the client have to take anti-TB drug, and they have also to take corticotherapy at a rate of 40 mg per day by decreasing the dosage gradually per month. Then you have to do pleural drainage because in pleural tuberculosis there is accumulation of fluid into pleural membrane. The miliary tuberculosis, which is massive dissemination by circulatory way, duration are developed disseminatory in all organisms. This form of tuberculosis, especially it attacks the children and those who are immunocompromised. The acute form of TB, there is no specific clinical sign, but the client have cough, have dyspnea, have weight loss, have coughing, and so on. Diagnosis is done based on chest X-ray. When you do chest X-ray, we found the image of mirror into the lungs. Treatment, the client have to take treatment without waiting. And without treatment, the prognosis is bad, means it leads to death. Meningeal tuberculosis. This is the severe form of extrapulmonary tuberculosis, which is mostly attack the children who was not vaccinated and the people who are immunodepressed. The clinical signs are generally fever, lethargy, vomiting, photophobia. There is irritability, conversion, stiffness, coma. Then it is also fatal without treatment. The diagnosis, you have to do lung puncture, and other essential examination which have to be done is HIV test. In lumbar puncture, we take the cerebrospinal fluid, then the liquid under pressure, where increased, there is also increased protein, there is lower glucose, and increased leukocyte. Means in a person who has meningeal tuberculosis, when you take the cerebrospinal fluid, it is under pressure. Means it come out with pressure. There is increased protein within the cerebrospinal fluid, while there is also lower glucose and increased leukocyte. They have also to search for Koch bacillus in the cerebrospinal fluid. Then you have to start treatment as soon as possible without waiting the results of culture. Bone tuberculosis, it will attack the bones and the articulation. Then the articular tuberculosis often touch the large articulation like hips and knees. The pelvis vertebra, the TB that touch usually the medial thoracic vertebra by blood or lymphatic way. The pelvis vertebra is called also inyonjo in Kinyarwanda. It is one of the complications which can occur in person with bone tuberculosis. The clinical sign for bone tuberculosis, the client has back pain, anterior erosion on the vertebral body, which will compressing. They have also kyphosis, means an excessive backward curvature on the top part of the spine. The possible paraplegia also can occur in people with bone tuberculosis. The diagnosis is based on clinical, on radiological image, and tissue biopsies. Treatment, you have to start treatment as soon as possible, and you have also to do mobilization of the vertebra or the spinal cord, or surgery also is used in if the rashes is unstable. The difference between rat TB infection and TB disease. A person who has rat TB infection, they has no symptom, they don't feel sick, they can't spread the TB to others. Usually, they have skin test and the blood test which indicate TB infection. He has a normal chest X-ray and the negative sputum smear. No need of treatment for active TB, but they need treatment for later TB infection. As you remember, the treatment for later TB infection is isoniazid to avoid or to reduce the risk of getting TB disease. A person with TB disease, they have sign and symptom as usual, where they have bad cough that lasts at least 2 weeks or more. They have also pain in the chest. They have hemoptysia, means they coughing up blood. They have also fatigue. They have weight loss. They didn't have appetite. They have night sweating, and usually they are sick. Those people can spread TB bacteria to others. Usually, they have skin test and the blood test result which indicating TB infection. They have abnormal chest X-ray or positive sputum smear or culture. Those people they need treatment to treat active disease. Complication of tuberculosis. The person with tuberculosis may have massive hemoptysia, may have pneumothorax, which can due to the rupture of cavern into the pleural cavity. They have also chronic respiratory failure. As conclusion, by prioritizing prevention strategy, we can reduce transmission rates and move toward eliminating this ancient yet persistent disease. Prevention is better than cure. Thank you for your kind attention. Those are the reading books we can use and get more information about tuberculosis. This is the end of tuberculosis session. If you have any question, you are welcome.